One, we are live. TikTok number 16, 28th of December. Got out of work a little bit earlier today because I stayed late yesterday and I stay late tomorrow. So a little bit earlier today. It's fantastic. Cash Money's joined. Erblin and Drow joined. What's up, friends? What's up, friends? What's going on? We're in here. Got the podcast set up. Got the lighting. Lighting's okay. Good stuff. Ashley Golden joined. What's up, Ashley? Philly joined. Bridge Bear 4 joined. User 22519 joined. Tomperkins joined. Ashley joined. Mama Day joined. Dean M joined. CT joined. The name is Mommy joined. What's up, friends? Chris Williams, Charlie Monroe. How are we doing? Kenneth Johnson, Taylor, Carl. What's up, everyone? Cash Monies. Can you decide to go back and specialize after working as a general dentist? Absolutely. Yeah, you can do it. You can do it. It's not as common. I have seen it done actually, but it can be done. Cash Money Z asked that question. Thanks for asking that. What else we got? What else we got, friends? I'm wearing the scrubs today. I just got out of work a bit ago, and I figured why not wear the actual uniform today? Most of the TikTok lives I put on just regular clothes or workout clothes or maybe a button down. I did a couple lives ago. Flolo joined, Jason on vacation joined, Chase joined, Jonathan Shane joined, Marky Mark and the Funk joined, Skylar Taylor, Danielle joined. What's up, friends? How we doing? How's everyone doing today? How's the week off going? How's the week off? I don't have the week off. I don't have the week off, unfortunately. I was on call on Sunday into Christmas morning. It was a 24-hour shift, 25 hours. It was a long day. I'm not on call this coming weekend, I found out. So that's pretty fire. That's pretty fire. Jamie Christian joined. What's up, friends? Lulu joined. Coach Bill. Gary Vaynerchuk just put out Jets Browns tonight. Gary Vaynerchuk just put out a tweet saying that. Let's go Jets. Let's go. We get any Jets fans on? Banana, that's a nice watch. Christmas gift or no. Thanks for asking, Banana. This is the Tag Heuer Aqua Racer. It's an automatic watch. It's got the chrono. Obviously, you could see it, right? The push pins to time things. It's automatic. Caliber 16. That's the tag. Thank you. Thanks, friend. It wasn't a Christmas gift. I got this for dentistry, and I got it prior to dental school. This is going back 7 years now. Yeah. I just put out. Bruh just asked thoughts on head and neck surgery. It's fantastic. And look, you're going to be doing a lot of cancer. And if you go into head and neck surgery, at the residency I'm at here, we just had a chief last year who graduated and went into a head and neck fellowship. So in oral maxillofacial surgery, if you get your ND, it helps a lot too. I'm not getting my ND. I don't want to go into head and neck. I want to work in a private practice, outpatient office setting, right? And so basically he graduated and went into a head and neck fellowship at another program. It's a 2-year. Oh shoot. That's a 2-year fellowship. Yeah. Banana said nice. Thanks, Banana. If you guys just saw the TikTok I just put out, look, guys, I think something we need to talk about is many times doctors don't know how to talk to patients, right? I see it all the time, and this is not a knock on doctors. This is not unprofessional. We need to be better as doctors, as dentists. We need to be better working with patients. We've got to be able to better communicate and connect with patients that we're treating. And so what I said in that TikTok is I think it's eye contact. The first and foremost thing, you might not be able to rehearse a poem or recite the Declaration of Independence backwards, but you can make eye contact, right? Every time you walk in the patient's room, you should be trying to make eye contact. I think that's very important. It's very underlooked. And I think that's just my recommendation. Something I need to work more on. I do it every day. But focusing on this eye contact and asking the patient, how are you doing? How are you doing today? I think is super important. I think that's really, really important. Angie Garcia, thanks for everything you do. Thanks, Angie. That's very sweet of you. I appreciate that. I'm getting the TikTok live in today, by the way, because I'm not going to be able to get this weekend. It's going to be a busy weekend. It's New Year's Eve weekend. I got a birthday. It's Holly's birthday. Shout out to Holly. Happy birthday coming up. It's New Year's Eve, New Year's Day. I am off, but I'm going to be away. So getting the TikTok live 6. I do one every weekend, right? I do one every Sunday night. I try to Sunday, Monday usually ends up being the day. the latest is Wednesday, but I do it so I can ask questions. We can hang out on here and chat a little bit. So getting it in today, since I got to work a little bit early. Let's hit it. Let's go. Underscore. Will 2024 be your last residency year? I graduate in June of 2025. So I still got 1.5 year after all of 2024. So I got a year and a half left right now. Bruh asks, does your hospital offer electives? In oral surgery, not really. We really don't get electives. The hospital does have electives in certain specialties. However, not in oral surgery. We really don't. Webb C. Garrett. What's up, Webb? What's up, Webb? What do you enjoy most about OMFS? I like surgery. I went into dentistry because I wanted to use my hands, and I knew that I had an interest in oral surgery. I'm doing surgery now as a dentist, and we do very invasive surgeries and stuff. It's the most interesting part of dentistry that I like. And I like dentistry because it still is very different from medicine in that you could be your own boss. You could work directly for the patients in an outpatient setting. That generally has a better lifestyle and quality of life than the medical side of healthcare, where you're working a lot in the hospital. And now all the outpatient offices are generally bought up by the hospital systems, as I'm sure you've seen. And it's corporatizing medicine. And now that's starting to happen in dentistry. I don't know how great that is, because if you ask doctors, not too many of them are happy with what they're doing. You know what I mean? And so we'll see how it goes. I'm hoping to make a difference in this field one day. I keep a very open eye, and I learn from all these interactions, these experiences in my residency. That is, oral surgery is the link between dentistry and medicine, right? Within healthcare. It is, because we're dentists, but now we're being thrown into medical settings, general surgery settings and such. So very important. I'm hoping to use these experiences to learn as much as I can, and then give back to the profession one day to make it better for patients, number one, and make it better for providers as well. I'm not so convinced. In fact, I don't think corporatization of the healthcare field benefits patients or benefits providers. I really don't. I know there's a lot of things like, oh, well, now you could just go in and then leave at the end of the day. Yeah, but now you don't have tax write-offs. You work for someone else and not directly for the patient. That adds to the disconnect between the patient and provider experience, and so on and so forth. Your salary is going to be deducted by about 50% because of taxes. I mean, I could go on all day, but essentially it's really autonomy. I think providers should have the ultimate autonomy working with patients directly. And all right, I'll stop talking your off. But yeah. Banana, preach. Yeah. Chai pox. Yes. Eye contact and active listening. Yes. Active listening, engaging with the patient in live conversation, right? I can't stand the whole, and look, sometimes, and I said this in the TikTok. I just said this in the TikTok. Look, you don't know what the doctor's going through right at that moment. Doctors are humans too. We're not robots, right? So, well, anyway, just a joke. But doctors are humans too, and we're going through a lot. The amount of tasks, especially in residency, that you have to do, the amount of patients you need to see. Sometimes they're covering multiple hospitals. It can get out of hand. It can get ridiculous. It can become insanity. And got to know that from the doctor's, from the patient's standpoint. Got to know that about the doctor, and then the doctor about the patient is every time you step in that room, utmost undivided attention, everything you got with that patient in that moment, and connecting with them, communicating with them. Just like you said, Chai Pox, active listening is important. And I think it starts with eye contact. That's why I made that TikTok. That's why I put it on YouTube, put it on podcast. So let's keep going. Oh my God, you guys are amazing. Look at all these comments. Banana, Lord, they walk in and go straight to the computer, so disconnected. Yeah, and I'm sure I've made that mistake too. I'm sure you have to take notes. You really have to take notes. It's tough. And who makes these operatories? Who makes these patient rooms? The patient's over here, the computer's over there, and it's facing the wall. So now the doctor's all huddled up in the corner. I'm getting shoved into the corner here, and you need to take notes, right? If you get behind, then you're staying until 9, 10 o'clock at night. And then you're missing things in the note if you're not typing actively while you're in the not in the procedure, but in the appointment necessarily. You know what I'm saying? You miss details. That's not safe. So just my thing, I like to get that note in the majority finished during the appointment, because that's the way you can take the best note, and you could leave off. You could start off right where you left off at the next appointment, right? That's my thing. But at the same time, that should not conflict with you seeing the patient. And now that the healthcare industry is totally overrun by insurance, everything's about what insurance covers and what they don't cover. And then when things are done, it's like trying to play catch up with insurance companies to make money for the procedures you did. And then patients, they're like getting things done. Oh yeah, I'm going to get the MRI and everything. They find out it's not covered. Like there's so much going on in healthcare. It's so much friction. And hey, look, I think insurance companies, they cause so much friction. In some ways, they help patients get care that they need. And I could say just as much as that, in many cases, insurance companies are preventing patients from getting care that they need. I mean, a simple cleaning at the dentist's office, an MRI for the prostate that's absolutely needed. Come on. Come on. Standard of care, apparently, now for the prostate is the MRI after a certain point, right? And how is it a negotiation then? If that's standard of care, how is it a negotiation whether the insurance company covers that or not? Why do you have insurance then? What's the point? I could go on. The stories I hear, the stories I get stuck involved in and such. Oh, anyway, Ruby, what can be done for the neck disc pain? I mean, look, there's over-the-counter pain medications. This is not medical advice. You'd have to consult the doctor that you might be seeing. Maybe it's ortho, maybe it's neurosurgeon. I don't know what your condition is, what your situation is, but I would definitely consult them first. They may send you to a pain specialist. I don't know. You got to ask them. Okay, I don't do necks. I don't do neck pain, like the vertebral column. We don't do this. We do neck dissections in oral surgery to do cancer resections and such, to see extent of which cancer has spread as far as the lymph nodes go and whatnot. So we do that, but that's not what you asked. Libby, cutie. Thanks, Libby. Carol Vivieros 881. That's so true. I mean, I'm sure some things I'm saying wrong. I'm human too. Not everything I'm saying is 100% correct all the time. I know, but these are just my thoughts and my experiences, what I've seen from my experiences. Angie Garcia, June 2025. Congratulations. Well, thanks, Angie, but I'm not there yet. I'm not there yet. Thanks, Angie. Himu 99. Do you have any tips on how to stand out as a residency applicant coming from a pass-fail school? Well, yes. So are you talking about for the medical side of healthcare or dentistry? Because in dentistry, in oral surgery, the way you're going to stand out is the CBSE score and then your externships that you did at certain programs, right? From the medicine side, I'm not so sure. I didn't go that route, right? Because in oral surgery, we come from dental school to residency. So the medical side of standing out as a residency applicant, I'm not so sure. I'm not so sure. I'm sure clerkships, when you get like a month to spend at different programs with certain services, I would really plan those out accordingly. I would really strategically plan those out. Underscore, is hospital food good? For the most part, not really. Some hospitals, like the private hospital here, just down the street, just across the street, excellent. Actually, the food there, I can't say it because the institution doesn't want people on social media mentioning the program because then it comes off as representing the program, and I'm not representing the program in any way, shape, or form. That's why I don't mention it. But yeah, the private hospital food is actually outstanding here. Shockingly, it is. It is good. A asks, what do you think of the corporate offices and their care in dentistry? Well, it depends, and we're still getting there. We're still learning more about it as a profession, as the profession of dentistry in general. But generally, corporate offices, what makes it corporate, right? Someone at the top or a group at the top, in many cases in DSOs, it's private equity. And these private equities are based off of funds that vest in about 5 or so years. They invest a lot of money into the fund and they're expecting to get 2 times, 5 times, 20 times. I've seen, not in dentistry, but in private equity. I have private equity friends. 20 times more than the money that you put in. Now, the whole point across those 5 years is to pay back those investors and make them happy, right? And then the corporation sells into a new fund that has to vest in 5 years. So the whole thing is that they're looking for strategies and ways to make more money out of the system. You can do that to an extent. And then what happens? But look, what happens is they're taking money from the doctors, right? They're charging more for patient care. They're taking money off the table that the doctors are earning. The doctors are earning them, but the people at the top, the administrators, are taking the money off to pay back the investors, right? Look, that's how it goes. The whole idea of a corporate environment is to corporatize. Get the goal is to maximize profits, right? The way you maximize profits is to get the doctors on a salary scale, because then you could push them to do more work and still get paid X, rather than X times every time they do this procedure, that procedure, work X amount of days. It makes it more clean cut, and then you could predict quarters in the future and stuff. But then essentially what you're doing is doctors are going to be working more and getting paid less. That's why that and look, they don't teach this in dental school. They don't teach this in medical school. That's how it goes. It's and look, patients lose. Patients lose because then the doctor ends up having to be pushed to see more patients in a certain amount of time in a day, and then the patient's just a number. So this is what I've seen from me going to the doctor's office. This is what I look at in the hospital to see what goes on, like what's actually going on under the hood from behind the scenes. This is what I've seen. This is what, so it's tough. You got to be careful. Now, corporatization can be beneficial if it's being led by the doctor, the surgeon, and they're not just trying to sap out all the money of the system. They're actually trying to make it better for the doctor, where they provide the doctor or dentist or surgeon what they're looking for. The daily schedule. Can they meet the money, the salary requests? Can they meet the call requests? Can they, the hours, the days in the office, like no weekends, or so on and so forth, right? The marketing, that's a big thing. A big thing. If you don't market, no matter what you do, it could be dentistry, could be medicine, could be nails, could be, say you're a nail or a hairdresser. The person that does the best marketing for hairdressing, all the all the clients are going to go to that hairdresser, right? Because they market the best. And that hairdresser isn't going to be able to handle all those clients at once. So they need to hire more. Over time, what happens is the best marketing is the best net for the clients, right? If you don't do any marketing, you end up working for someone that does the good marketing, right? That's that. And look, I could be wrong with this. This is what I've seen from my experiences. This is how I see trends go. This is what I see happen. Banana, what kind of surgeries do you perform? So in oral maxillofacial surgery, we do everything from, like I said before, head and neck cancer, resections and stuff, the mouth, squamous cell carcinoma is one example, tongue, mouth, head and neck, and then all the way to most common procedures are like wisdom teeth extractions, dental implants, big dental implant cases, complicated extractions, wisdom tooth extractions, sedations, bone grafting, sinus lifts, tori reduction, biopsies. I'm sure I'm missing one or two, but these are some of the surgeries we do in oral surgery. We also do facial trauma, so fixing facial fractures, for example, mandible fractures, Lefort 1, 2, 3 fractures, NOE, naso-orbitoethmoid fractures. That's in this general area. Yeah, we could go into that too if you'd like. But nasal bone fractures, I've done a number, probably more than 10 nasal bone fracture reductions in the ED, just bedside. Yeah, so stuff like that. Connie Lingus, is this Conan O'Brien's little sister? Yes, I'm Conan O'Brien's little sister. That's me. Omid Omar Kale followed the live creator. Thank you, Omid. Justy followed. Thank you, Justy. Omid said, which state you suggest to move to? Well, it depends on what you're looking for. It really depends on what lifestyle you want too. Like, are you looking to live in the city? Looking to live urban versus rural, suburban? Castle iron, a belt buckle. Cast iron, a belt buckle. When you're in residency with your IM/DO colleagues, is there any difference? Do you do ICU rotation? I'm on the ICU rotation right now, man. Yeah, I'm on SICU right now. That's the surgical. You know this. I know. But for everyone listening, SICU is the surgical ICU. MICU is the medical ICU. I did that a year ago this month. Yes, so we do ICU rotations. We do all of them. We don't do CCU. Actually, the 6-year residents, believe it or not, the 6-year residents, as you know, they get their MD, right? I'm a 4-year resident. The 6-year residents spend those extra 2 years in medical school getting their MD. They don't even do the MICU rotation here. Isn't that crazy? The 4 years, such as myself, I don't have my MD. I didn't go to med school, just dental school and residency. We're the ones that do the MICU rotation. The 6 years don't with your MD. Isn't that crazy? Isn't that wild? And the MICU rotation, let me tell you, if you don't know, It's a big rotation. There's a lot going on. Banana, had ortho surgeon try to convince me to let him operate, but he never pulled my pant leg up to look. I mean, I don't know ortho. I don't know, I don't know orthopedic surgery. There's a lot you can understand from an X-ray. Probably a good idea to look at the patient clinically, but I don't know. I don't know. You know what I mean? A asked, how do you feel about trying the AI systems that make history notes that don't violate HIPAA? I'm not. I'm not sure. I don't know. I haven't tried that. We don't have that in our house, or maybe we do, and I don't know about it. I'm not sure. Sounds pretty cool. I mean, as long as you're writing that note at the end of the day, AI can immensely help and aid the process and get things to be done faster. Right? Here's the issue. The more like they keep talking about speed, right? Like these organizations, these medical service organizations and dental service organizations, they say they're going to do the marketing for you, they're going to do the business for you, they're going to do the management for you, they're going to do the hiring and firing for you, they're going to do, but and then they're saying like this is going to allow you to see more. Why do you want to see more patients? I want to see fewer patients and do a better job and do the best job possible for them, and I want them to come back. Like the more patients you try and squish into a day, like if that's the sale pitch to making more money in healthcare, I think we're really going in a seriously wrong direction. We're already at that point. Mistakes happen. The more you see, the more repetitions you do, the more possible mistakes you are to happen. I want to see personally, as few patients in a day and do the best I possibly can for them and make it an outstanding experience. The best surgery they've ever had. No pain. Stuff like that, right? The more patients you see in a day, the more likely errors and mistakes are to occur. So, like, I think we're going in the wrong direction here. I think we need to be figuring out how to optimize the amount of time we have with patients, right? I thought that was supposed to be. So I don't know. I don't know how to change all this. It's not going to happen overnight. Maybe in the future. I have a lot of ideas. I don't know if anyone's willing to listen. Maybe one day, but this needs to be patient-centered care. This should not be insurance-centered care. That's all I'm saying, right? Do you agree with me? You know what I mean? Ben, can I still take on the main pre-med classes sophomore year done? Sophomore year is done. Congrats. Can I still take on the main pre-med classes? I think so. I'm not sure. I'm not sure what you're asking. Werben Jagerman Jensen, ever listen to Jelly Roll? I don't know. No. Werben Jagerman, because you all have the same body type. I don't know what you mean. I don't know. You call me fat? Jelly Roll? Do I have rolls? I don't know. Luke Ferrante followed the live. Thank you, Luke. Zachary, would you eat mac and cheese out the microwave? There are a lot of typos there if I read that correctly, but I can't eat mac and cheese right. I love macaroni and cheese, and I've been lactose intolerant for 3 years. It's getting better. It's getting better, but my God, Taylor, take my wisdom teeth. You got it, Taylor. Come through. Let's take them out. User 147165. What's the craziest surgery you've ever done, like gunshot wound, etc.? Craziest surgery I've ever done. Well, from my standpoint, I love the Zygomatic. I like big implant cases, right? Planned with a prosthodontics team. Prosthodontists are the specialists in restoring prostheses, teeth, etc., crowns, dentures, and in this case, an overdenture. An overdenture is something that latches into implants. So putting in multiple implants on the bottom or top jaw. The coolest case I like in the implants realm of dentistry and oral surgery is the zygomatic implant. It's when you put, these are the cheekbones are the zygoma. So you open up from the inside and you put zygomatic implants. They're this long implant into the back. You can put 2 in the back on the other side, 2 in the front on the other side, maybe 1 implant in the middle. Depends on the stability and what the prosthodontist team wants for support of the denture. And it's a big case. It's a lot of fun. You got to be very careful. You got to make sure you get enough stability on those implants. Those are what I like. Oh my goodness, you guys are amazing. So many comments. What are your favorite NFL, NBA, and MLB teams? So MLB, I guess the Mets. My dad's a big Mets fan. I don't watch much sports at all, right? I used to play basketball in college. I really don't like watching basketball. And the NBA, just from a college basketball standpoint, watching the NBA is like, what are they even doing out there? Why is everything a 3-point shot or one-on-one or like a dunk? Like, What happened to the Larry Bird days? Magic Johnson, Michael Jordan. God, I wish Kobe was still around in the league. That would have been fire. But NBA, I don't have a favorite NBA team. I'm not impressed with any of them, to be completely honest. Like, I don't see too many playing good basketball. That's one thing. NFL, I'm a Jets fan. It's hard to be a fan, yes, and I do like watching football though. I don't have any time right now. I like fantasy. Actually, I just got into the playoff spot in fantasy, so that was pretty sweet. So this week these 2 weeks. They're doing like a combined week thing. I don't know what it's called, but I'm in the championship. I was in third place, so I beat the second place, and now I'm playing against the first place team. Dude, I lost so many people throughout I had Jefferson, I had Cousins. Cousins is gone. Jefferson finally came back. I missed out on him the whole season. My leading kicker's out now. My defensive team started to suck, so now I got not Washington. Who is it? I forget who it was. Not Chicago. Who was? I forgot who I picked up. But so I've just been picking up people left and right. What is it? Nakwa Puka Nakwa. Nakwa Puka. I mean, he's been outstanding. So him, Jefferson. I got them back in now. I picked up what's his name, Rice on Kansas City. He's in my backup. I got Kamara. He's one of my running backs. Kind of sucked last week. But anyway, yeah, hoping for a good week. We will see. We will see. I like football. I like watching football. I like watching the Jets, even though you're a Jets fan. If you know, you know. Let's move on. Leland, how did you study for the CBSE and when did you start? So CBSE, I took it 3 times. First time, I didn't study for it. So for the second 2 times, and look, Leland, gotta go. I've put out many content on this. I'll do it. I'll brush through it quickly here, but I want you to look at some of the YouTube videos, and you could go to Instagram. None of it's on TikTok. It's all YouTube, podcast, and Instagram. Okay, mostly YouTube. You could probably just Google it, and it'll pop up in the YouTube search bar. But basically, so it's 2 paths through UWorld, right? The first one goes section by section. This is going to help you learn the subjects, right? Starting, say, with cardiovascular, do everything. Go through pathoma and boards and beyond, extract the content into first aid. Whatever's not in first aid that's in boards and pathoma and boards and beyond, put it in there. I recommend using the PDF version on your laptop so you could command everything and save time, move quick, okay? Extract everything into there. You could just use the little notes when you use the PDF of first aid. Next, Sketchy Farm to learn the drugs, and Sketchy Micro. Okay, those are the materials I used. First pass through UWorld, going topic by topic, right? Cardiovascular, do pathoma, do boards and beyond, review first aid, Sketchy Farm, done with CV, do the questions in first aid down, and then move on to palm, move on to renal, and so on and so forth. First pass through UWorld, again, section by section. Now you're going to do randomized questions in the second pass through UWorld. And now this is review. You wanted to consolidate, no more pathoma, no more boards and beyond, consolidate just to first aid, Sketchy Farm, maybe Sketchy Path if you use it. I didn't. And Sketchy Micro. Okay, now you simplified it to just 3 to 4 resources. Now it's strategy time. Now it's review. Question by question, randomized questions. I would do multiple blocks a day. First one in the day, because remember, when you take that test, it's most likely going to be in the morning. So I would do the first test of the day, the block on UWorld. I would do that randomized. Do it randomized. The next ones, I would go tutor mode. Now, that was time mode, right? Randomized, time mode. Now go tutor mode. Go question by question, randomized. And now you could review them as you do the questions so you don't lose the attention span because you're going to be drained throughout the day, right? Makes sense? Those are my recommendations for the CBSE. In a quick run through, a quick brush up. KBS, did you feel prepared for the MICU? I went to med school and I wasn't prepared. Look, like some of these rotations, it's like you can't prepare for it. And forget about getting like an orientation or whatnot. They just throw you in there first day, you got to go. So prepare for MICU like interning on service. I interned on 5 other services and anesthesia for 6 months or 5 months prior to my MICU rotation. Okay, so I was well oriented as an intern. There's no like formal orientation, but you're just thrown into the swimming pool and learning how to swim in a lot of these rotations. And then by the time I got to MICU, I could get stuff done that I needed to get done, right? You're an intern. You're not like a senior or, an upper level resident on these rotations. You're an intern. You're doing task work. It's fine. Learning a lot about what's being done in the critical care units, patient management, systemically, the entire body and whatnot. And it really helps when you come back to oral surgery, understanding what other services do, how to manage the patient in other areas and whatnot. Vadim 102572 asked, what is the difference in the two hospitals where you work? I actually work at 3 hospitals and the dental school. So one of them is a public hospital, one of them is a government hospital, one of them is a private hospital, right? And then the dental school, obviously. The difference, well, the public hospital is a level 1 trauma center of New York in New York City, and a big one. And so all the trauma goes there. Now, that's not to say we don't get trauma in the other places, right? That we actually do get a lot of trauma in the other, especially the private hospital for whatever reason. And then they are like the flagship hospitals of all the hospital, because they've all they're a part of other city hospitals. These are the flagship ones. So we get bombarded with transfers from the other ones to get managed here because it's like the main facility. You know what I'm saying? So very, very busy in these ones. Kevin said the earth is flat. Oh, well, sure. KB, follow the live creator. Thanks, KB, my man or girl, my gal pal. Marky Andrews. I feel like I am in a CE course. RDH here. Marky, what's up? I didn't mean to put you on a CE course. We're just here to chat, right? We're hanging out. I hope you're having RDH. I don't know if you get a week off for that. I know how it goes right now, especially in healthcare, right? We're being worked to death. But if you do have a week off, I hope you're enjoying it. Enjoy it. Hope you're with family, getting some time off, getting to relax a little bit, disconnect. Banana said, I agree. It's going in the wrong direction. I hate the 15 minutes. I've seen a doc breakdown. It's tough. RC, you kiss and tell? What do you want to know? Hunter Hogue, Dr. Gallagher, I'm class of 2028, UTHSC. That's University of Tennessee, I believe, right? Health. School of Dentistry student. Thank you for all the wise words. Oh, dude, Hunter, call me Brendan. And thanks for coming on. That's another thing. And of course, anything I could do to help, let me know. I'm actually doing a live Q&A right now at 3 o'clock. I'm going to start answering them. I put it up when I got up at like 6 o'clock this morning. It goes for 24 hours, right? You know how the story questions go. And then it gets put down. I'm going to start responding to them at 3. I didn't want to do too early. All right. We're literally, a few minutes away. Taylor at Kevin, LOL. Taylor at Hunter Hogue. Good luck. Hunter, dude, I'm here for you. Just send me a DM on Instagram. Anything I can do to help you out, all right? Let me know. And I hope some of these, you can listen to some of the check out the podcast that I'm doing. I do a lot of review questions, topics there, questions of the day on Instagram as well as LinkedIn and the podcast. The explanations for the question of the days I do on Instagram, students of dentistry as well as myself, I put the explanation in podcast. So that should help. On podcast and YouTube, I do a lot of like mentoring sessions and such, in addition to the lives. So I would definitely join as many as these as you can, so you could pick up stuff here and there. And also, dude, just ask me questions. Anything I can help with. All right. User 908809. Is it bad to apply for both 6-year and 4-year programs? No. It's fine. It's fine. And they can't look. The programs can't see how many you've applied to in either category. Don't worry about that. Do it. Go for it, and good luck. Unfunny MF1. Why would my dentist tell me I might need a root canal in 1 to 5 years? Oh, because there's a lot of things that can go into that. Maybe you had some trauma to the tooth and it's starting to become discolored. That's one example. You could have internal resorption of the canal. That's an indication to get root canal therapy. Say the tooth was avulsed, it was put right back in quickly, and it took within 2 to 3 weeks, we could tell whether it's taken or not, and the splinting comes off. That tooth's most likely going to need to be root canaled. Otherwise, it can get infected and lead to further damage and whatnot. You might have a very extensive cavity, for a fourth example, and the cavity has gotten really deep and it's near the nerve. It's not there yet, but your dentist might be able to see it, say, like, it's going to be there. Like, look, we're going to need to do root canal. Okay. Those are just some, you said it. He did a deep filling and then told me I might need a root canal on that tooth in 1 to 5 years. Well, there you go. Unfunny. He said, makes me wonder if he did something wrong. No, dude, no. Not necessarily did something wrong. It's just that you had a deep cavity, right? Oh, Wait, I got an emergency notification from the. Oh no, it's just the shuttle's not working. Sometimes we get these. Oh no, we lost connection. Unstable connection. It's back up. It's back up. Sometimes we get these emergency notifications from the institution. There's like a shooting. This, scary stuff. Yvonne, what's up, Yvonne? Final weeks of Invisalign with my dentist. I'm thinking of an ortho consult. Don't want to offend. So that shouldn't be offensive, okay? Now, Invisalign, the thing about Invisalign is that they market it directly to the patients and to the dentists, right? General dentists don't have extensive training in alignment of teeth, straightening teeth, right? An orthodontist did 3 extra years specializing specifically in straightening and aligning the teeth. Personally, that's what I would want to go to. Same thing for implants. Oral surgeons are trained for the most invasive surgery in dentistry. Implants can hit the nerve. You're putting a piece of metal in bone. That's invasive. Any invasive surgery, I want to go to a surgeon. Some periodontists do a lot of implants in training. Some of them are calling themselves surgeons. A true surgeon knows how to manage complications. Oral surgeons are trained to manage complications. All complications of the head and neck. I would include that. I'm not saying that periodontists aren't surgeons. I'm just saying that I think a true surgeon is able to manage any invasive complication that may happen, any complication that may happen in invasive surgery, right? I would just keep that in mind. That being said, periodontists are implant trained, okay? Now, anyone else doing implant, I don't know. I don't know what their training has been, but specifically, oral surgeons and periodontists are trained in implant surgery. Oral surgeons in all invasive surgery, especially of the mouth, right? Why would you want to go to a provider? So, like, would you go to your family doctor to get a knee replacement? I don't know, like, and I'm with you, Yvonne. Like, you don't want to offend someone, but don't you want to see the specialist who's specialized in that area of treatment? I don't know. Up to you. _ do you take any supplements? If so, what kind do you take? I take 2 supplements, especially this kind of year. I take vitamin C and zinc. It's obvious why I take those. It's for, the immune system boost. Zinc, I think, is the crucial thing because it really boosts your immune system. 1, it helps prevent illnesses and, colds from coming on. When you have an illness or cold, it helps shorten the duration. It's worked for me, for myself. So I do it all the time. I was taking zinc and vitamin C for months every day during COVID. And the worst I got was a sty during that point. Sty is like this, like zinc and vitamin C is going to prevent a sty. You know what I mean? But yeah, I didn't get COVID until 2022. So it was literally 2 years after COVID and I got it for the first time. So I don't know. I don't know. Comms Kimmed, follow the live creator. Thanks, Comms Kim. Glyphs. What's good, Brendan? From your experience, what do you like from your nurses? I really like, so here's the thing. What I try and portray myself as a resident, as a doctor, like, we're on a team here, right? We're here to help the patients. I try to give first and foremost, like, hey, what's going on, Brendan? Is there anything I can help with? How's it going today? What was your name again? Patricia. Hey, Patricia, how's it going? What's any updates for the patient? Anything I could get for you, you know what I mean? And then they usually respond like, no, and anything I could get for you. And it's like, no, but it's good. And now you know their name, they know your name. We're going to be working together throughout this. Or like, hey, Patricia, I'm on the overnight shift. Anything you need, just let me know, right? Because nurses come to you all the time when you're the resident and say, hey, can you just release the orders? Hey, can you change this to liquid solution rather than like a tablet or something? Things of those sorts. So what do I like? I just like open communication, and I really don't like drama. I'm gonna be. I don't like drama. I ignore it. I don't like. You're not gonna be coming to me telling me the he said she said thing. Like we're not gonna get along. Not that we're not gonna get along there. It's just you're not gonna fire me up. What's gonna fire me up is we'll skip that. But I get fired enough alone on here. So. What do I like from nurses? I really like good communication. I like someone who's willing to work with me and like we're going to accomplish tasks together. And when they thank me for things, I think it's because they see that I'm here to work with them, for the nurses. I'm the resident. You're the nurse. We're here together. We're here to accomplish tasks. so not to talk your ear off too much here, but I really like nurses who don't kind of like sometimes I come over and I'm like, hey, what's going on? What was your name, by the way? And and then they're like, why are you asking why are you, hey, what's going on? What's going on? Sorry, just someone's coming to my door. I'm getting a delivery today. I ordered wine. By the way, the delivery it's wine. I got a couple, 3 or 4 wine. Connection lost. Darn. I'm gonna reveal the next. Okay, we're back on, guys. I got a wine delivery coming in for a second. I just need to step away. But basically, couple week, 1 or 2 week, no, the third next Wednesday night, Surgical Gourmet. If you look him up on Instagram at surgical gourmet, that's Dr. Salib. He's in training to be in education, to be sommelier. I got 3 to 4 wine bottles. We're going to do it together. We're going to talk about oral surgery, dentistry, everything up until wine. We're going to do a tasting there that his recommendation is going to be fire. So anyway, I like. Oh, what I was going to say. The nurse came up. Hey, what's your name, by the way? Oh, Tim. Tom. let's say it's Tom. Tom, what's going on? And then he was like kind of standoffish. He's like, I'm going to tell on. I asked his name to tell on, which happens sometimes in the hospital, unfortunately. But I'm like, no, dude, wait, like, no, I'm here to work with you tonight. We have a couple of the same patients that we're covering. I'm here to work with you. All right, like anything you need, just let me know how I can help. So, that's the experiences I like about nurses. Let me just step out real quick. Give me 2 seconds. Hey, how's it going? You need me to sign? Thanks so much for coming back. Yes, that's me. This is me. Yeah. Thank you so much. Okay.
Time I finish, I leave with milkers. I said, let me call it.
Yes. Yes. Hey, you have a happy holiday this weekend, all right? Be safe out there. Oh, very nice. Nice guy. Nice guy. That was nice for him to come to bring it back here. He came earlier, but I was still at work, so like a phone call. He came back. It was very nice of him. All right, so let's get back to it. Maddie Bay asks, "You have such a positive attitude." Hey, where'd it go? 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 Maddie, you have such a positive attitude. Maddie, thank you. Sometimes working gets stressful. We don't always have the most positive attitude. One of these things, the last month or two, I've noticed, by the way, this is a little trick. I'm getting up a lot earlier. I have a lot of work that I do. Like I run Students of Dentistry account on Instagram, Elite Dentists we're doing right now. That's part of Sean, Sarah, and I's group of like the Students of Dentistry team. In fact, trivia nights in 2 weeks, by the way. We do oral pathology trivia. You have a chance to win a $100 Amazon gift card, $50 Amazon gift card, or 25. So the top 3 finishers are winners, right? We do that on purpose. And it's a good way to review oral pathology as well if you're in the dental field. That being said, oh yeah, so one of the things that's helped me with the positive attitude, I get up a bit earlier, like literally 2 hours before I go in. I get up earlier. I do a 10-minute ab workout, kind of just wakes you up, refreshes your mind first thing in the morning, first thing. And then what I do is I do all my work before I go in. So that's Students of Dentistry, Elite Dentist, Top Wineries is me as well. I started that one about 7 years ago. And then those, if I could get them in before. But what I've been doing is the podcast too. So what I'm doing on the podcast is I do the question of the day, Students of Dentistry, my page, LinkedIn. And then I do that, like I said before, the explanations to the question of the day. I put that on the podcast, okay? And a little motivational quote to start the day off if you're looking for some stuff. Excuse me. So that's so getting that all out of the way. And look, maybe you like to exercise at the end of the day, but whatever you do beforehand, maybe it's cooking, maybe it's making your lunch for the day, maybe it's having breakfast in the morning. I have breakfast in the morning too. Getting this stuff done before you go in clears your mind. It cleans the slate for the day, and now you could just focus on what you need to do at work. Whether that's a day, whether you work for Amazon as a delivery truck driver, UPS, maybe you work at a desk job in the office. Clearing your head before you go in, I think, is super. It's very important. And I think getting up earlier, as hard as it is, it's simple. It's one thing. Getting up a little earlier, and yet it's one of the hardest things I think you could do in a day. It's a super challenge, but if you accomplish that, you immediately reap the benefits. So I recommend that. And I've been having a much more positive attitude too, by the way. So maybe that'll help too. Log followed the creator. Thank you, Log. T-Rex, does the dental school you go to matter? It does. Different dental schools have, well, the tuition, right? The tuition's going to really dictate how, the cost of your time in school. It's going to reflect on how much loans you might have to take out, for example. The class size is big too, right? A bigger class size, you're going to get less attention during dental school. A smaller class size, you're going to get more. I'm also noticing in the residency trail, the smaller dental schools generally place more resident students into residencies, specialties residencies, right? Generally, I'm talking like Stony Brook is where I came from, class of 44. We placed 4 into oral surgery. One of the years before, so placed 6. The year after, placed 5. That's a huge percentage for a dental school. 4 to 6 out of 44, that's huge. NYU might place 4 to 6, maybe in a year. They have 400 students. So I would keep that in mind. It absolutely matters. And I would look at the percentages that they place into specialties each year, because it's most likely going to happen when you are graduating, right? Makes sense? Jake, in and out. Why is your tongue dark? My tongue's not dark. I don't know what you're talking about. Blister in the moon. OMF surgeons are the smartest dudes in med school. Fact. Nice. Well, I'm not in med school. But I don't know if I'd be on that list or category, but maybe one day. Blister in the moon. I appreciate that you saying that about oral surgeons in general. They are some of the brightest people in the dental school classes. I would say that for a fact. New York City, Carlos, what's up, Carlos? What's the best morning and night routine? Let's do it. Sure, let's go get into it. The best morning routine, like I was saying, look, definitely recommend having breakfast. You got to power up before you go into work. Clear the slate, clear your mind. Get any tasks that you need to do. Maybe you like to work out in the mornings before you go in, and it clears out the rest of the day. Do it. You're going to be much happier and much more relaxed if you do that. I don't have time to do a full workout. Plus, I do my side work before I go in, like the post, the podcast, the question of the day, and that stuff. So clearing that off the plate's big for me. The first thing I do, though, is a 10-minute ab workout by Pamela Reif. It's outstanding. I just do it on my little carpet next to my bed here. As soon as I wake up, I go to the bathroom, pee, come back, and I do that 10 minutes. You can make time for a 10-minute ab workout in your mornings. I only do it on weekday mornings. And after about 3 months, I swear to God, I had a 6-pack. So I took off for 2 months, and I'm back on it the last couple weeks. That's huge. So the morning routine, nutrition, getting up earlier, maybe a little bit of exercise. I think that's fire. Making sure you have lunch for the day ready to go. And then clearing off any tasks off the plate, such as like checking emails and whatnot. Huge for the morning routine. Night routine, I like to get everything set up for the next day done at night. So I clean the dishes at night. I do Spanish lessons on Duolingo every night. I make my lunch. I prepare my lunch for the next day at night. I get my gym clothes ready at night. I get my scrubs ready for the next day at night. The morning abs, that's just shorts and t-shirt. Shower before I go to bed. That really I really get relaxed and that calms me down. The last thing I do is shower, brushing teeth, flossing, saying my prayers, and going to bed. That's my, for the most part, that's my night routine. It could take a long time. Yeah. So that's my night routine. Unfunny MF, is a DDS a certified dentist? Yes, they are. DDS and DMD, they mean the same thing, right? They're different words, but they mean the same thing. They're like synonyms, right? Nicholas Canitz, unfunny MF. Yes, that's right. Person with an emoji. When did you take your CBSE exam? So the first time I took it, I didn't study for it. That was after D1 year. The second time I took the CBSE was after D2 year, and yes, I studied for it. 3 months. The third time I took it was in the middle of D3 year, February 8th. And I only studied about a month for that one, but I got a little bit higher score than the last one, and that's when I got the score I needed. Not what I wanted still. That's when I got what I needed. NJ Pizda, RN for 4 years, made the decision this year to take the MCAT and apply to med school. I'm 30. Thoughts? Yeah, Dentistry too. Like, look, a lot of people are going back and going for these professional degrees and schools. I think it's fantastic. You have more life. It just my understanding, my thoughts. I think you have more life experience than anyone else that's just gone from high school to college to medical school to the residency to this to that. And life experience, I think, is in the top five, 3 to 5 things, probably top 3 things I think you need when you're going into a profession like this. You need to know what the world is like out there in order to maximize your understanding of what you're getting yourself into prior to going into it. Does that make sense? You know what I mean? It could get stressful at times. But if you have 4 years of being an RN under your belt, you have 4 years of experience in the field. You've been doing it and you know exactly why you're doing it now, right? So first of all, respect for you, nurses out there. If we have any nurses on this call, my hat goes off to you. I don't have a hat on today. I know I got coffee here, so cheers. But no, I'm serious. Nurses, first of all, I think you guys should be treated a lot better. Second of all, I think they need to hire more nurses at hospitals and pay them a little bit more, a lot more. And same goes for residents, just to point that out there. But hat goes off to nurses. The work you do, phenomenal. I'm wishing you all a great holiday season. And let's go next question. User 12309. So did you check out the Densadrills? What's a Densadrill? No, I didn't have time to check out a Densadrill. When I got off the last call, I didn't look it up. I'm sorry about that. Can you tell me what a Densadrill is? But you got me. I didn't check it out. I meant to. I've been putting up LinkedIn posts on reviews of the nasal NOE fractures, nasal orm, the approaches and surgeries to manage that, right? When the medial canthal tendon is attached, when it's not attached, the type 3, the Lefort fractures, types 1, 2, 3. What was another one? There was another one I did. There was this is in the last 3 days? I forget. Okay, so can you still describe the stages of prophase, metaphase, anaphase, and telophase? No. I can't describe that. So like prophase is the general life cycle of the cell, right? That's like 99% of it. But then once it goes into, what is it? It's the division phase, right? It's like Q phase or something. There's like P and then S1, which is intermittent phase, and then we're going into the cycle of division, right? And then we have metaphase is when like the genetic material starts to polarize in the nucleus, right? Anaphase is when they're completely in the poles and start to divide. Telophase is when the whole cell starts to divide, right? And then what is it? It's not cytokinesis. What's it called when it completely divides? Well, whatever. Luke Predental. What's up, Luke? Luke, thanks for coming on, man. Thanks for coming on, Luke. Hope you had a nice holiday. Well, I got out early Christmas morning because I was on call overnight. I had a fire Christmas though. I got to see Luce, her sister's fiance, and their cousin up on the Upper West Side, and had some beers, hanging out. Ate. They cooked. It was amazing. I got a new watch. Actually, I got it over there. It's a Jack Mason. I got 2 watches. They're both Jack Mason. Awesome brand, by the way. American assembled. I don't know if it's American made, but it's American assembled. They're a really good watch brand. Big fan of them. And now I have I'm super weird like this. I'm throwing super weird. I like to have watches for certain like mindsets. So I have like the oral surgery study watch. This is like my just dentistry in general, like professional and surgical, like everything in dentistry was this. I have the residency watch. I have I have the weekend watch. I have a beach house watch. I know it's weird for occasions and for mindsets, because sometimes you got to disconnect from work, and one way I disconnect is like switching up the mindset, and sometimes I like to facilitate that and force myself based on switching up the watch. It's super weird and unique, but look, it works for me. And now one of them I use for my morning routine. It motivates me to get up that 2 hours early, and get right to work and get it done. So look, it's weird. It works. It's a little strategy that I put in place that's proven to be effective for me. Maybe something like that will work for you. Maybe it's a handbag. Good ladies, maybe it's a handbag. Get yourself that handbag and don't look back. But maybe make sure this isn't financial advice. Maybe make sure you can afford, what do they say? You can afford 2 of them before you buy 1. Just thoughts. Trisha off the grid, follow the live. Thank you, Trisha. Maddie Bay, follow the live. Thank you, Maddie. And thanks for asking questions, friends. Vadium 10 25 72. Dr. Gallagher, you are the best. No, no, no. And call me Brendan. Call me Brendan. Thank you. Thanks. I appreciate that. What can I help you with? Debbie Will 02. Hello, Brendan. Debbie Will 02 shared the live. Thanks, Deb. Thanks, Deb. Shema followed the live creator. Thanks, Shema. Antonio Rubio Jr. 3. I let him hit. I thought that was going to be like talking about you. Oh, yeah? Yeah, you smash? Yeah? EM, any tips for D1 and D2 years for balancing study for top grades and enjoying life still? Yes. Yes. The breakthrough for efficient studying and effective studying, right? Effective is getting higher grades. For me, I'm a visual learner. What worked for me was writing things out. You don't have enough time to write things out 5 times in dental school. You don't. Get it on a Quizlet, get Quizlet premium version, and put figures onto it because we're visual learners, right? That's going to help you with effective studying. Now, Quizlet allows you to get more reps in. More reps, getting better at it, allows you to get more efficient studying less while maintaining effective studying. So still getting those A's, but in less time. This is how I did it, and this is how I can best explain it to you, right? Quizlet, use the figures, premium version, get the figures on there because we're visual learners. You're going to learn it more effectively, and then get those reps in. Get right to work, get those reps in, and that'll make you more efficient, okay? More efficiency gives you more life to enjoy, and there's your answer. All right, Ian? Let me know what you think. Debbie Will 02, I was always a prepper for the next day. Exactly, Deb. Exactly. I think the morning routine is the key to the night routine is the key to the morning routine. Getting to bed a little earlier, waking up a little earlier, getting things prepared and set to go the next day. Hey, Brendan, I have a question. What you think about getting respiratory therapist degree? I think it's awesome. We work with in SICU or with respiratory therapists all day long. They don't hire enough respiratory therapists for the hospital, from what I can see. They're running ragged left and right. They do awesome, such great work. But I don't know. Like we need like every other patient's on a vent, right? You need respiratory therapy when you're transporting these patients, resetting settings and whatnot. We got to get more respiratory therapists in the hospital. So it's needed. That's not the question. Are places willing to hire? Does that make sense? Zach said, yo, yo. What's up, Zach? Debbie Will, my daughter's a nurse. LOL. Nice, nice. Thank you to her. NJ Pizda, you're the man. All the best. Cheers with the beer emojis. NJ Pizza, you're the best. And I hope you enjoy the weekend. Be safe. Please, everyone on this call right now, I'm serious about this. The facial trauma, especially this week, has been out of control. And I put a TikTok on this yesterday. The TBI, it literally is TBI season. Please, go ahead, drink all you want, whatever. Please be safe. Please be careful, especially when you're walking, when you're going to the bathroom, when you're out on ice. Maybe you're in an icy area. Just be careful this weekend, okay? You don't want to be coming into the ED and seeing me. Debbie Will, I had 3 teeth pulled. Now I have bone bulging out of my gum. Should I have that bone removed? I would get a consultation. I can't give you any medical advice through social media. What I would recommend and suggest is seeing your local dentist. Maybe you need to see an oral surgeon and get that taken care of. I don't know the situation. I haven't seen your x-rays. I wouldn't be able to tell you more than that. You know what I mean? Jackson Holder, dentists are so unhappy in real life. Some of them are. Some of them are very happy. I would say right now, in general, of all the dentists I know, more dentists are happy than doctors. All right. And I've seen this trend over the last 10 to 15 years. Just my thoughts. That's what I think. That's why I'm in dentistry. My mentors were dentists. Debbie Will 02 Jackson Holder, not at all. My dentist is awesome. There you go. There you go, Jackson Holder. Adele Zim, have you ever heard of Shinola watches? Oh yeah, Detroit. Oh, I love Shinola. I love Shinola. In fact, one of the Jack Masons that I have literally looks like a combination between a Shinola casing, right? It's like that trench watch casing, as well as the Panerai. The numbers, the lume, the simple face that it has. It's like a combination between a Panerai and a Shinola. I love Shinola watches. I went to the original factory. This is going back, I think, 9 years. Visited a college buddy who's from Detroit. Shinola's great. I think they started with bikes first, if I'm not mistaken. And now they have like bags and stuff. Shinola, fantastic brand, American made. Love those watches. Thanks for bringing those up. Yeah, yeah, yeah. Debbie will owe too. LOL handbags, definitely. Vikram Bulkinkir. Did you know you wanted to go into OMFS before dental school? I knew I was interested, right? I didn't know enough about other specialties. So I went for the moon, right? I went for oral surgery, and I knew that it's the most competitive, not the most competitive, it's the hardest residency specialty to get into. But I knew that through dental school, I'd be able to learn more about the others. So I knew I was interested. I didn't know definitively. I thought so, but yeah. Smoke. Quizlet got me through undergrad life. Smoke. This is Smoke. Asked that. Mentioned this. Smoke followed. Oh, thanks for following me, Smoke. Yeah, dude. Quizlet, fire. Highly recommend. Now, if you really want to get good at it, and this is tough in dental school, this is really tough because you're taking an equivalent of 32 credits a semester, right? That's ridiculous. Very little time. But if you can get those, some professors or doctors in dental school, they send out the presentations early. Get those presentations, the material into Quizlet first, the figures in there, get it prepared, get it outlined, right? And then during the lecture, listen and input anything that the teacher talks about that isn't in the slides. Those are usually test questions, by the way. Put them in the Quizlet. Then you're done. Don't even study the nights. You study it the week before the test comes in, you're good to go. Boom, boom, boom. I was getting to it where I was just studying the Quizlet the night before. I'd get through it 3 times and maybe one more the morning of, and I'd be getting 90s and above. And you can do it too. It's practice, it's repetitions. And if you do it this way, I'm telling you, you're going to have really good scores. Jarrett King, handsome. Oh, kind of you, Jarrett. Hart asks, do you recommend taking Bio 1 and Gen Chem 1 together in one semester? Yeah, why not? Winchester _5, 2v2. What's the treatment path for a sphenoid effusion? I'm not sure. We don't treat sphenoid effusions in oral maxillofacial surgery. Maybe at some programs they do. I haven't heard of anything of that sort here. That might be ENT. The sphenoid is really back there. That might not even be ENT. That might be neurosurge at that point. That's a good question, though. Good question. Debbie Will, thank you for answering my question. Of course, Deb. You got it, Deb. My cousin's named Debbie, by the way. She's in Orlando, Florida, Winter Park, Florida. They're lawyers down there, Debbie and Scott. Shout out to Warner and Warner law firm. Zach, currently finishing my nursing degree, but want to apply to CRNA school or NP school. Any recommendations? Yes, go for it. CRNA and NP and PA, I think these are the hack in healthcare. Very, very much less schooling. It's more of like an expedited track. You're doing very similar stuff, if not the same thing as some doctors in some cases. And you're going to make a lot more money with less debt or tuition taken on through the schooling, right? I think it's the hack. I really do. CRNA, I might put it number 1, by the way. CRNA is the anesthesiologist, the nurse anesthesiologist, certified registered nurse anesthesiologist. You're basically an anesthesiologist at that point. You're making a ton of money. And I think you need to do 2 years in the ICU or something. And then you could apply for CRNA school. It's the hack. It's incredible. Good hours, everything. Cher, are you streaming off a webcam? Yeah, right behind. I'm streaming right here. I'm streaming. This is Riverside. This is the podcast app. So now I'm going to record and put this up later on YouTube channel, on podcast, and Twitter. This way, this is TikTok 16. If you look in the title, save it for later. Anything you want to re-listen to, anyone that couldn't make it, this way you can listen. I do this for all the TikTok lives. I do it for interviews, some meetings, calls. Yeah. Guys, if you can, check out the YouTube channel. It's at Dr. Gallagher. Same thing. Podcast is Dr. Gallagher's podcast. Spotify, Apple Music. I hope you helped it. I hope you enjoyed it, and I hope I can help you. Any questions in the future? Just from my experiences and stuff. I'm not like the most important thing. I'm not like a superhuman doctor or anything, but I am here for you. Adele Zim, my daughter went to U of Mich and worked at Shinola. Now she's in Hudson Yard. If you're single. Can she get me in Shinola? You're funny. Adele, you're funny. That's funny. Hudson Yard, nice. What is she doing in Hudson Yards? THGHG dues. Dude, what's up? You're already out? You're at UConn, right? You're already out for the day? Sweet. I gotta say, SICU, I've been getting out earlier than basically all my other rotations. Anesthesia, I got out early some days too, but dude, SICU's been fire. It's been super busy, but like I'll stay late one day, the other interns will stay later the other days. It's been a good experience. Advice so that I take the CBSE only once, take it D1, 2, 3 year. Take it as many times as you can. You don't study for it the first time you take it. Just take it to understand what this beast is, what this beast looks like, right? Um, After that, I would say obviously study for it for the next times you take it. Take it as many times as you can. I wouldn't take it during D1 year though. Wait till after D1 year, and then I would take it every 6 months until you get that score you need. Okay. To answer your question, so that I only take the CBSE only once, I wouldn't go in with that attitude. I wouldn't go in with that objective. You're going to take it more than once. You're going to get the best score you can on it, and that's how you're going to succeed. Okay, and that's fine. That's fine. But do you see what I'm saying? If you only want to take it once, like go in as if you're only going to take it once, but expect like you're going to have to take this test more than once. Okay, if you're going to maximize your opportunity to get into the residency you want, you're going to want to beat that score that you get. You know what I mean? Got it. Debbie Will, hearts, faces, awesome. Thanks, Deb. Addie asks, what's the best way to get Sugondies out of your teeth? I don't know, floss? Sugondies. You're funny. Adele Zim, accounting at Ernst & Young. Oh, hello. Does she live in Hoboken? You said she's in Hudson Yards. I think there's a Hudson Yards Ernst & Young. If so, she's at EY. Does she live in Hoboken? I miss Hoboken so much. That was one of my favorite places I've lived. I lived there for 2 years during college. It was a lot of fun. Beautiful place. You wake up to the skyline of Manhattan. Oh, I wish. I try to live there again one day if I can. Addie 100. Addie says, thank you, Doc. You got it. Libby Williams joined. What's up? Ali Star joined. What's up, friends? Oh, okay. We're at an hour and 6 minutes now. I think I'm going to sign off. It's 3:00. I got to get back to the. So, guys, on Instagram, same thing, at Dr. Gallagher. On Instagram, I'm doing a live Q&A session now, and then I'm going to answer the clips into the story, and then I'll save, and then they're like the story answers. So anything I couldn't get to here, anything I couldn't answer, just ask there on the Instagram live. The second thing is I'm going to save this and put this out on YouTube and podcast, okay? So if you can, get me on the YouTube podcast. If you can subscribe for me, I'd appreciate that. And any way I can help. You know, I'm not on here trying to sell you stuff, sell you garbage. I'm not doing that. I'm here for you, here to help out. Any questions I can help with, and go from there. Last question. Is your residency program based out of a dental school? It's based out of a hospital, 2 hospitals, but it is associated with a dental school. Yes. Okay, one more. NeuroMD. How annoying is it to get rid of a maxillary sinus tract? It can be annoying. It can be annoying. I mean, what are you going to do? What are you going to do? There's a lot going into it. Sinus precautions, if it's really in the maxillary sinus, stuff like that. All right, friends, signing off. Thanks so much for coming on. I love you guys. You are my family. And let me know what you think. Podcast, YouTube channel. Let me know how I can help you out. Let me know what you want me to talk more about, what you want me to do better, what I can do. Everything centered around you guys. All right, friends. I'll talk to you soon. Peanut Hive says, no. Stay, please. I got to go. All right, guys. I love you.